Good morning. Someone just messaged me and said that I was muted. Tanya Torno here, Deputy Director with Riverside County Continuum of Care. Not sure how much you heard of what I said, but I just wanted to welcome each of you. It looks like our chairs are here. As always, both Greg Rodriguez and Karen Roper are always ready to go, and I see our team is here as well. We want to thank you for joining us. There's 59 of you in attendance, and so what I was trying to share earlier is just a reminder that these meetings are recorded, and we appreciate you muting your devices. Of course, there will be times throughout today's meeting where you will have the ability to unmute yourself and add to the conversation. I know our chairs certainly welcome that, and we have a dedicated public comment section at the start of the meeting. So it looks like everybody is on mute, playing by the rules. So thumbs up to you. Thank you for joining us today. And now we're looking at 61 people in attendance. So Greg and Karen, if you guys are ready, and you know what, Josh, let me look at you. Can you give me a thumbs up? Are things looking good on your side? All right. Yeah, so if we're all good, Greg and Karen will lean on you guys to help direct us on whether we should begin.
All right, thank you, Tanya. We will begin. It's 10:04, so we'll call the Wednesday, September 22nd meeting of the Continuum of Care to order. First item, new members we have this month is Brilliant Corners, Inland Empire Harm Reduction, RCC Guardian Scholars, and Starting Over Inc. What I would like to do is actually call on each one of you just to introduce who the representative is and welcome you to the group. So first I'll call on Brilliant Corners. If they're not here, I'll move on. Do we have Inland Empire Harm Reduction? And I don't believe RCC Guardian Scholars was on, unless you are. Josh said they might not be on. And then what about Starting Over Inc.? My batting average is horrible today, so. All right, great. Well,
just to give you a heads up, we do still have people popping in here and there. I'm still admitting people into the lobby, so.
Okay, maybe I'll make a call at the end. So, and then item B under the call to order, we do have new voting members. So these are groups or agencies that have been participating in at least the last 3 meetings and now have full voting rights. That would be the City of San Jacinto, Desert AIDS Project, and then Riverside Unified School District. So welcome to those new voting members as well. We'll move on to item number 2 is the approval of the July 28th, 2021 CoC meeting minutes. Those were in the packet, also in the Google Drive. And Josh, if you could post the Google Drive link in the chat. So
yeah, absolutely. Also, just wanted to remind you we should do a roll as well.
Oh, yeah, sorry.
Okay. So I'll pull up the actually, Jonathan, if you could post the Google document folder in the chat so that people can access it, I will pull up the roll call. And
sounds good.
We'll make it a quick one today so we don't spend too much time. All right. Access Foundation, Cordell, I know we spoke earlier and you're calling in.
I'm here, yes.
Catholic Charities. Peanut.
I'm here.
City of Corona.
Karen Roper here, blessed to be here and participate with all of you guys.
All right, thank you, Karen. City of Eastvale.
Here.
City of Hemet. City of Lake Elsinore.
I'm here, thank you.
City of Menifee. City of Moreno Valley.
Dina Heald is present from the city of Moreno Valley.
Thank you so much, Dina. City of Marietta.
I am here.
All right, City of Paris. City of Riverside.
Michelle Davis, present. Good morning, everyone.
The famous Michelle Davis.
City of San Jacinto.
Good morning,
Thank you, Robin. Coachella Valley Association of Governments, CVAG.
Good morning, Anise Smith here.
Coachella Valley Coalition on Youth Homelessness. Coachella Valley Rescue Mission.
Kimberly McKinney present. Good morning, everybody.
Good morning.
I'm here also, Mark McGowan.
Thanks, Mark. Community Health Association of the Inland Empires.
This is Brianna.
Inland Southern Region, sorry about that. Department of Public Social Services. Desert AIDS Project.
Monica Atchison.
Desert Healthcare District.
Joshua, Donna's here. She texted me. She's just having audio problems on her computer. So.
Thank you so much for that. Faith in Action. Family Promise. Habitat for Humanity. Tammy, I think I saw you here.
I'm here. Thanks.
Thank you. Jewish Family Services. I think I saw Becky here earlier.
Yeah, I see her online. So.
Lake Elsinore Unified School District. Lighthouse Social Service Centers.
Good morning. This is Karen Younglow for Lighthouse.
Lutheran Social Services. Martha's Village.
Here.
Linda. Mercy House. Alina Healthcare.
Mercy House?
Sorry, was that Mercy House?
Yes, Mercy House, Dave Jacobs.
Dave, I don't have you on here, but let me, if you want to send me a updated proxy letter or representation form, and if you need copies of those, let me know.
I should be there. I'm the primary.
I'll double check. Could be an error on our end. Thank you.
Yeah. Thank you.
Alina Healthcare. Operation Safe House.
Hi, Rainbow with Operation Safe House.
Thanks, Rainbow. Path of Life.
Hi, Casey Jackson with Path of Life.
Casey.
And Leonard Jarman too.
Animal Services.
Good morning.
Morning. Is that Emma?
Yes, it is.
Riverside County Office of Education.
Stefan, present.
Thank you, Stefan. Riverside County Hot Team.
Good morning, Deputy Julia Cruz here.
Riverside University Health System Behavioral Health.
Good morning, Marcus Cannon.
Riverside Unified School District.
Ozzy present.
Ozzy, Shelter from the Storm. Social Work Action Group. One second. Transgender Health and Wellness Center.
J.M. Kennedy present.
Thank you. UCR Health. United Way of the Inland Valleys. US Vets. VA Loma Linda.
Good morning, this is Oscar.
Oscar. And Valley Restart.
Yeah, here, thank you.
So,
Josh, I know that Edna LeBron from Menifee is here. She was having audio problems. Edna, you've got your hand up. Is that why you had it up?
Yes, good morning. I am here. Thank
All
you.
right. Thank you, Edna. And then I see a hand from Joanna Lechuga.
Yes, hi, good morning. I'm actually a new member, but I wasn't on the list, so I just wanted to introduce myself. I'm with the District Attorney's Office, the Division of Victim Services here in the Indio area.
Great. Welcome.
Thank you so much, Sharina. I did receive your letter, by the way. I think I got it earlier this week. So sorry I didn't make it right on the agenda, just because posting guidelines, but welcome.
Thank you very much. I'm excited to be here.
And then I'm sorry if I'm going to butcher this name, but Ramphis Franco.
Hi, yes. My name is Ramphis Franco. I'm with Mental Health Systems. This is our third meeting that we participated in.
Perfect. Thank you, Ramphis. Really appreciate it. Again, if I didn't mention your name in the roll, that was just for the voting members. Please put your name and organization in the chat so we get your attendance, and we can notify you if you've attended 3 in a row and gained voting rights.
And then my last one is Sarah Cortez de Pavon.
I think, hello?
Hello?
Yes, my name is Sister Casey, Oasis Community Group.
I think that's it, Josh.
Oh,
Thank
and
you
this
so
is Sarah. This is for, you called Sarah Cortez de Pavon, but it's actually Rebecca Rivera. I'm using her, the computer, but for City of Paris.
Okay. Thank you.
Thank you so much. All right, we have a full
And
house
Sister,
today.
hello, can you hear me? I'm Sister Casey of Oasis Community Group.
Thank you. I'll be sure to write that down too. I noticed that you're on the phone. If you do have access to the chat, feel free to write your name and organization, but I'm taking that down for you.
No,
too.
I don't have access. Sorry.
No problem. Thank you for letting us know.
But I've been a member for a long time.
Okay, we'll make note of that. So, all right, great. Great turnout today. I also want to recognize that Supervisor Karen Spiegel is on the line too. So welcome, Supervisor. Appreciate you attending. So, all right. So now we will move to approval of the minutes. Again, those are in your packets. Were there any corrections or additions? And again, raise your hand if you've got any. And if not, we'll go ahead and entertain a motion to adopt the minutes.
Karen Roper, move to adopt.
Thank you, Karen. Is there a second?
Kimberly McKinney, CVRM, will second.
Thank you, Kimberly. Any further discussion? All right, not seeing any. Are there any opposed? If you're opposed, please raise your hand. And then any abstentions? All right, not seeing any. Minutes passed unanimously. Thank you. All right, right now we will go to public comments. So this is a chance for any member of the public to make comments on items not on the agenda. Do we have any public comments?
I'd be happy to make a comment, kind of an announcement.
Sure.
So just as an encouragement to all of you, out there that do such a great job helping so many people. I wanted to give you an example of how you can turn a challenge into an opportunity. We had just a minor little glitch. We do contract with the Path of Life for beds while our shelter is under development. And they had a brief period of quarantine because of the COVID outbreak or as a result of testing. And so we wanted to make sure that we had available beds and resources for our homeless neighbors. So what we did was we quickly worked with our police department and CityNet, and we're able to expand that program to after hours, which is really cool. It's something very unique to be able to have access to resources through 12 a.m. So 7 a.m. to 12 a.m. So we're pretty excited about that. And the only reason why I'm sharing that with all of you is just how you can take something that's challenging and figure out a way to turn it into something positive. So that's my encouragement to all of you. Thank you, Greg.
Welcome. Thank you. All right, Jacob.
Yes, morning, everybody. This is Dave Jacobs over at Camp Anza, and I just wanted to make an announcement that we have apartments available for veterans and their households. So if you know any veterans that are facing homelessness or that are homeless and in need of long-term housing, we have 2 and 3 bedroom apartments available over here at Camp Anza. I'm going to go ahead and just put my contact information in the chat. And so it's going to be the contact information for myself and for Nora Armas. She's the community director, and she will be the one that you can contact to get any information about the application process. Thank you very much.
Great. Thank you, Jacob. Always good to hear about available units. So next, we've got David Jacobs from Mercy House.
That was me.
I think we were swapped. This is Jacob Rostovsky, and I think that was David Jacobs' way.
Okay.
Hi, very nice to see you again. This is Jacob Rostovsky, he, him, his pronouns. I'm with the with QueerWorks, and we're with the Trans Power Project. It's a brand new project that received funding from the CoC COVID-19 grant. I just wanted to formally introduce myself and let you know a little bit about what we're doing. We're the county's only program that works to providing completely free mental health services to the trans and non-binary community, as well as free case management to help find housing, healthcare, employment opportunities, and all that really great stuff. So if you have any clients who are looking for anything having to do with really anything along with the trans and non-binary community, please send them our way. I'll go ahead and put my contact. Also, we're looking for organizations that can house homeless or housing unsecure trans and non-binary individuals. I've been having a little bit of a difficult time finding places that have explicit non-discrimination and safety sort of procedures, and a lot of our clients are kind of wary of going to places that don't have safety procedures in place for the community. So if you know of any or you yourself provide, please reach out, because we do have quite a few clients who can use some housing. So thank you, and really nice to meet all of you. I'm really happy to be here.
Nice to meet you.
Thanks, Jacob. I should have recognized your name. I apologize. So, Jacob, if you could throw your contact info in the chat in case anybody can fulfill the request, would be great. You already did. Thank you. All righty. Not seeing any further public comments. We will move on to item number 4, old business. Item A is the fiscal year 2021 Housing and Urban Development, or HUD CoC program, NOFO instead of NOFA. So, Natalis taking the lead on this, I assume.
All right, good morning, everyone. My name is Natalis Ng, and I'm the Administrative Services Officer of the CoC Division of the HHBWS Department. And yes, correct. And so the acronym has been changed to NOFO instead of NOFA. For decades, it has been NOFA, and then it stands for Notification of Funding Availability, and then now it stands for Notification of Funding Opportunity. So, and next slide, please. All right, so I think I will have to make it bigger on my end. Yes. So and then so for 4 months we have been announcing that the CoC program competition for 2021 is coming, and then finally HUD has opened it on August the 18th, and then it is closing November the 16th. Even though it is almost like 3 months, but then there are a lot of elements inside, so it's still not a very long time, and it has very tight timeline. So the elements inside this competition, the application, and then it is made up of the on the left-hand side, you see the CoC application that includes narrative and attachments and web postings. And then we also work on the new project applications. Right now, we have the request for proposal open on September the 10th, and we just extended the deadline to the 30th of September. And that includes the available funding potentially for DB bonus money is about $2 million, and CoC bonus is about $678,000, and reallocation money we are thinking of about $2 million and plus, and those have yet to be finalized and approved. And then also planning project is always a new project every year, and that is 380,000. Also, in the green part, you see the renewal applications. So that would include the annual renewal amount of $11 million, and then we have received the letters of intent to renew. And then we are talking about 14 renewal projects, including HMIS and CES. And we already know that the 3 projects are not renewing, and then therefore we know that the reallocation money we have about $2 million plus. And then on the right hand side you see the priority listing, and then that is also an application to put inside this big application due on November the 16th, and that includes tier 1, tier 2, and certificate of consistency with consolidation plan or consolidated plan. And then so all these components will be gearing toward the target board of governance review date of around mid-October, and then our target final approval date is about end November, and we want all documents to be ready by about November the 8th, so that we can press the button to submit on November the 15th, and then the HUD that will be a day before HUD deadline of November the 16th. And then we have been advised by our consultant that we do not want to submit too early, because HUD in the past they have pushed out new information and like even just a few days before. So we don't want to push the submit button too early. And then I also want to let everyone know that in the link that Josh has provided with this notification of the meeting, and there are also the updated appeals process, reallocation process, and unspent funds policy, and no major change from before, mainly the updates of the terminology from DPSS to HHPWS, because we changed department, and then I also included at the bottom right corner the website of our Riverside County CoC Noble website. And if you want to know any information and how it's progressing and all the materials, they are all posted on that web page. Next slide, please. So earlier we talked about the request for proposal for new projects, and here are the and that on the right hand side, I'm so sorry, it is very small, and then it is so our bid notification did go out on September the 10th, and then on the right hand side it is what it looks like. And even though you may not be able to read, but then you can see that there are number 1 to number 8, and so there are 8 project types for people to choose. And the highlighted part says that the closing date of the RFP has been extended to September the 30th. And then we have already mentioned the details here, the funding, and then all proposals and must be submitted by September the 30th at 1:30 p.m. And then the RFP information is also on our CoC Noble webpage. All right, so that will be the update of the 2021 notification of funding opportunity, and then I'm sure that you will be hearing more about this, and then there are more information. There is more information to come out. And any questions so far?
Any questions for Natalis?
I thought there was a question in the chat from, is it Casey?
So let me look.
It was answered on the screen, on the previous screen. I didn't see the new deadline and half heard ended, and now it's been answered. Thank you.
All right, thank you. So if we have no questions, and thank you very much for the time. And again, stay tuned. More information is coming up, and all information will be on the CoC Noble webpage. Thank you.
Natalis, to you and the whole team that is working on this, just want to say thank you guys and acknowledge you. I know how hard all of this work is, and you have to turn it around very quickly on top of all of your other existing duties and responsibilities. So we just want you to know how much we appreciate all that you do to keep this funding flowing into the region.
Thank you very much. Thank you.
Thanks, Natalis. All right, moving on to item number B is the 2022 homeless point in time count. Laura.
Good morning, everybody. This is Laura Gonzalez, the CoC, and I'm excited to serve as the PIT coordinator for the 2022 count, and I look forward to working with all of our communities. I just wanted to provide an update. As most of you probably already know, we will be kicking off our planning beginning tomorrow, September 23rd. If you haven't received an invite, please let me know. And we will begin our planning efforts. We will provide a lot of updates. For the general count, we've begun building our planning teams. And by reaching out to all of our city mayors, managers, and law enforcement and asking them to assign their point of contact for the count. That's an important piece for a successful count. I believe we have about 10 cities that have already assigned their city PIT count leaders. And our city PIT count leaders bring a lot of knowledge about their cities. They're the experts in their cities. They help us identify homeless locations and work with volunteers on the day of the count. And so we will continue to work with them to make sure that all 28 cities has a primary city leader. For the youth count, we are also working on enhancing our planning teams. We've actually made a lot of additions to our team compared to previous counts. For example, in the previous counts, we've always done our best to include our youth advisory committee. They're going to be very involved in planning the youth count. Our youth action board that we are continuing to build through the help of our homeless youth coordinator. And then just bringing on more youth with lived experience so they can help us plan a successful count. A new addition is a part-time youth PIT coordinator who has extensive homeless youth outreach experience through his position at Operation Safe House. And then, of course, you all know we have a new position to our HHPWS team, which is our homeless youth coordinator, Monique Guerra. She's doing a great job building the youth action board and just really getting her involved in planning the PIT count. Also, we've extended our partnership with Urban Initiatives. They have staff there that have a lot of experience planning PIT counts, and so they're going to be working with us in all aspects of our planning and implementation. And then, of course, our community. We could not conduct a successful count without our valued partners. And so we look forward to meeting with you tomorrow to kick off 2020 point in time count. As some of you may have noticed, our theme is more than a count, which is going to bring on a lot of additional components to the count that are needed and that will be helpful for our population that we encounter when we're conducting the count. So like I said, if you haven't received the calendar invite, please connect with me. I'll put my email in the chat. If you have any questions, connect with me. We are here to help and work with you for a successful pit count.
Thank you very much. Any questions?
Greg, I'm struggling with raising my hand electronically. I just wanted to add to Laura's last point about the 2022 point in time count being a more than a count initiative. And really, again, just speaking to that, we really take your feedback. In this case, we wanted to acknowledge our district offices who, during our debriefing meetings with them about previous counts, really encouraged us to shoot for the stars and, really come back to purpose, so that while, we definitely look at getting a more accurate count across each jurisdiction, that we also look at ways that we can connect with individuals who are unsheltered and participate in the survey so that there are aftercare services being provided. And so to that end, we feel extremely grateful. Many of you are aware that we have launched our district street outreach teams, and we'll hear a little later from both Marcus Dillard with the Housing Authority and Lindsay Sisti, who is with our CoC division, on how those district teams are working to support referrals and provide services to residents across each district, and of course the cities in those districts. But again, we wanted to take advantage of that program and that new model that we just launched to ensure that we capture a little bit more information during the survey, so that on the same day count, but also following the count, we can provide the street outreach teams with a dedicated list of residents in their area in which they can, follow up some aftercare support. So again, keep sharing your ideas with us. We, of course, shared this with Joe Coletti, our HUD consultant with Urban Initiatives, and his team, and they were truly inspired. And I know that they're taking back this idea with other communities, but know that Riverside County started this up. So thank you all.
Thanks, Tanya. Excuse me. Laura, I did have one question. How are we going to address, say, a pit lead in the unincorporated areas?
We generally, when we start planning, there's different components of the count, and we generally have planning meetings specifically for the unincorporated areas. So we will definitely be working to identify a lead, and then kind of setting out the plan in terms of what's the best way to count in the unincorporated areas. And also, I think it's good to mention at tomorrow's meeting, we will talk about kind of a contingency plan in the event that coronavirus is still affecting our communities and we have to make some adjustments. But we will plan this together with our communities, our city leaders, and anyone that is involved in the planning, so that we can have a good backup plan if needed. But for now, we're going full steam ahead with a full count in Riverside County at the end of January.
Perfect. Thank you, Laura. Any other questions for Laura? All right, seeing none, we'll move on to item number 5, new business. Item A is standing committee membership. We are proposing a couple additions to the current existing standing committee guidelines. Josh, if you could go to the next slide. You will see the proposed standing committee guidelines. This is really just kind of to clean up or add some language that basically aligns with the charter. And Tanya or staff, if you need to chime in if I'm getting this wrong, just go ahead and do so. But it's pretty straightforward on the new proposed language, so that would be added to the existing standing committee guidelines. Josh, if you want to go to the next slide as well. It's just basically making sure that we're appointing a primary and secondary representative for each agency. I want to really emphasize this does not preclude a one agency from sending multiple people or having multiple people participate in a standing committee. The current guidelines, though, will be in place that if an action item requires a vote, that each agency will only have one vote, although that doesn't preclude, again, participation from that. So happy to take questions, Susan.
Good morning. I have a set of questions. My first question is, my first statement is thank you very much for the red line. I appreciate it. It makes it much easier to figure out what is different. Two questions. Is there a timeline for this implementation? Because I'm assuming that we will all have to now send in these letters. And I'm also asking, assuming that the county is going to keep track of who's voting members on what committees. So I guess my real question is the timeline.
Yeah, I can chime in. And Susan, one, know that we definitely thought of you when it came to the red lines. We knew that we had to get this out, and truly we appreciate you because one, you make sure that we remain in compliance. So thank you for your feedback. Secondly, I'm going to thank you again because, you know, normally when these we receive these approvals, they're implemented the day that they go into effect. But it sounds like you are suggesting that we sort of work towards an implementation date. Staff is totally open to that. I'm wondering, right, it's September 22nd, if we want to look at perhaps, I don't know if that would be like a 2 to 4 week timeline. We could certainly, you know, start fresh and say we want to implement by November 1st. Just thinking about, you know, there's going to be some back and forth and us needing to follow up with agencies to ensure we have the correct paperwork in place. So we're open.
Okay. I'm just, you know, I appreciate that. I'm just thinking, okay, I'm gonna have to figure out who's on what. Okay, so we only have me on most of the committees, but you know, who's on what committees and who can be a backup and stuff like that. So thank you.
Susan, this is Laura. Also, just to answer your second question, we will track who each agency assigns as their primary and secondary. So that will be kind of our thing. So we'll make sure that we keep those letters filed and up to date in terms of what agency has assigned as their representatives.
Thank you.
And Susan, chime in here if you don't agree with this, but Tanya, our staff is, I don't want to get too bogged down in bureaucracy and process on this since it's just standing committee. You know, and we know agencies change representatives, is that, you know, if say at one meeting you've got somebody that's the lead for that agency, but then they're replaced by the next one, it's just simple verbal notification of the department fine on that change.
I would suggest an email maybe instead of the verbal, just so that you have a trail sort of thing.
I want to be mindful of staff's time as well as bureaucracy within the agencies as well. And when I use that bureaucracy within agencies, I don't mean that in a bad way, but just not having to create extra steps of an application process and all that. So
I agree. We don't need a whole new letter.
Okay.
Yeah.
We like email. We have lots of conversations with you guys on the phone, sometimes via text, but I agree that I like Greg's idea. We don't necessarily need a formal letter, but email would be great. So we can make that addition.
All right. Any other questions on this item? All right. If not, I would entertain a motion to adopt the staff recommendation.
This is Brian Ambrose. I'll make the motion.
Thank you, Brian. Is there a second?
This is Emma, second. Oh.
Okay, Emma, thank you.
Beat you to it, Susan.
Yeah.
All right, any further discussion at all?
I think the only other thing is once it's finalized, probably just need to double check each of the committees to make sure that the members that have been participating meet that criteria. And if not, there'll need to be some follow-up action to get them in standing.
Yeah, that's a good point, Karen. My recollection, though, is everybody that participates usually participates in everything. So pretty much it. All right, seeing no further discussion, is there any opposition to the motion? If so, please raise your hand. Excuse me. All right, any abstentions? All right, seeing none, motion passes unanimously. Thank you. All right, item number B is a check-in letter to CoC membership. We just wanted to give, Karen and I wanted to give you a heads up on this, that we'll be sending out a letter to CoC members. And what we're trying to do through these CoC meetings is, really kind of have them a little bit more interactive. Of course, we've been doing our multidisciplinary webinars, which have been highly successful and informational. But we're basically going to send out a letter to you to see what you like or don't like about the CoC meetings, and we won't take anything personally, trust me. But more importantly, if there's anything you'd like to see as far as programming as we move forward into next year. So just kind of wanted to give you a heads up, that'll be coming. So we would appreciate a response from as many of you as possible. So any questions on that? All right, seeing then we'll go to item number C, the Emergency Solutions Grant CV Street Outreach Teams. Very excited about this. Is Lindsay, you're going to take the lead first, or Marcus?
I got it. Do we have the slide? There we go. Hi, everyone. My name is Lindsay Sisti, and I'm with the Continuum of Care, and I'm privileged to serve as the program specialist for the Emergency Solutions Grant Program. We call it ESG. I am here with our partner, Marcus Dillard, from the Housing Authority, who's going to also be providing an update on the implementation of our ESG coronavirus district focus meetings in a few minutes. The CoC, it's been quite a few exciting months, very productive. We've been awarding, planning, and finally launching a countywide coordinated ESG CV program to provide services across all 5 supervisorial districts. And today we will quickly be reviewing the awarded activities, the outcomes attached to them, and the coordination and collaboration that's been happening with all 5 districts. So we can go to the next slide. First off, I just want to highlight this picture. I feel like this picture perfectly captures the goal of ESG CV funding, which is to get families into permanent housing placement as quickly as possible, where they can be the most protected against the coronavirus. This is really what the purpose of ESG CV funding is. So how are we doing that? Well, we have 3 main activities being funded. That's rapid rehousing, street outreach, and emergency shelter. First, for our rapid rehousing under ESG CV, we have funded 6 agencies to serve and house a projected 420 households by June 30th of 2022. The rapid rehousing providers are targeting several groups experiencing homelessness, including our seniors 65 and older, justice involved households, as well as households currently on our CES by name list scoring for rapid rehousing. For our street outreach ESG CV projects, we are funding 16 projects. We really wanted to build capacity here. And with these 16 projects, we really are building street outreach efforts that allow for coverage across the entire county. We anticipate 6,400 individuals to be provided services countywide. And then in addition to our traditional street outreach teams, we've funded street outreach teams with specializations in serving youth, transgendered and non-binary individuals, justice-involved households, individuals with behavioral health and substance abuse disorders, as well as individuals with medical needs. And moving on to our third activity being funded is our emergency shelter projects. We've funded 9 projects that include both congregate and non-congregate shelters, such as Project Room Key, which has allowed for our most vulnerable homeless clients to be sheltered in a non-congregate shelter setting and connecting them with supportive services. Additionally, to our regular shelter operations and essential services, we have other projects such as the construction of pallet shelters at Valley Restart that are prioritizing senior households and supporting the warm weather shelter that Martha's Village has coordinated for households experiencing homelessness out in the Coachella Valley. You can go to the next slide, Josh. Perfect. Okay, so now we've funded the projects. We have our plan. What have we been doing to get these programs launched? We have been doing a lot to help the launch of these programs. We hosted a kickoff meeting on the 18th of August. This was for all of the leadership from the funding agencies to share in our vision to house 420 households through the expansion of overall coordination and collaboration of services across the county. Next, after we had the meeting with the leadership, we launched a boot camp for all of the frontline staff that are working on these projects on the 25th and 26th. It was a two-part ESG CV boot camp, bringing all the frontline staff together. In this meeting, we broke the teams out into their district teams that they'll be working with over the next year to serve the districts and to, again, increase collaboration to address homelessness in the particular region. These district teams have already started meeting. Their first meeting was on the 30th. The meetings are happening every other week, and this coming week will be our third meeting. So Marcus Dillard will jump on in a second to get more into the nitty-gritty about what those meetings are looking like. And then the last item that we have supported the Continuum with is a training specific to ESGCV for CES, VICE, FDAT, and HMIS training. With the large amount of agencies funded, we recognize the need to have a special training just to make sure everybody was getting started on the right foot. We had a lot of new staff who weren't familiar with these processes, so we hosted that for them on August 30th. I'm sorry, on September 2nd. With that, I'm going to pass it over to Marcus Dillard to highlight our district focus meetings that are happening every other week.
Lindsay and Marcus, before Marcus, you start, could we just see if there's any questions or comments on just this ESG portion of that? And I do have one, but I'm just waiting to see if there's any others. First of all, I just want to give a huge shout out, like Karen said, to staff is just their ability to get this pot of money out the way they did and as quickly and really targeted focus. So I appreciate that. I did have a question on how are we tracking or monitoring the spend down, and will there be option or opportunity for reallocation of dollars that may not be being spent?
Can I
Tanya?
chime in, Lindsay?
Yeah.
Oh, perfect. I wanted to share, and I had made a note to do this, so Greg, perfect timing. We actually have developed a quarterly reporting schedule so that we can bring back updates both to the continuum of care, but also our district offices, each of our board of supervisors, to show the progress made both in spending, but also on the number of clients served and successful linkages to housing and the other interventions funded. We can send out like a brief summary, but just so you guys know, those reporting periods are scheduled for early October, January, April, and July. So you'll be getting regular updates on this. Secondly, in regards to whether there will be an opportunity to reallocate some of this funding, to Lindsay's point earlier, we have a very tight timeline to spend down the funds. 100% or 33 million in funding has to be spent by July 7th or July 30th, based on our current projections. By December, we are on track to spend close to 50% of the funding. And again, this is all thanks to the different projects that we're working with who have started up services and are being very active and proactive in making sure that, you know, we're getting the activities delivered to both unsheltered and sheltered folks in the community. With that said, as we continue to monitor progress like any other program, the answer is yes. If projects are not on track to perform, and really we're looking at this as a continuum, as a, you know, county approach. So if we find that there are gaps in this model and there's funding that may go unused, we will absolutely look at reallocating some of those dollars to, you know, activities where, you know, there's success in spending and potentially looking at other new projects to fund.
Perfect. That's the answer I wanted. Right. Any other questions on that? So, all right. Great. Thank you, Lindsay, for indulging me on there. So Marcus, kick it off, bud.
All right, good deal. Thank you, sir. So in our bi-weekly meetings, first off, we thank everyone for their cooperation in those meetings and participation. It has been outstanding, the responses that we've had from the various agencies. During that time, we're getting program updates from everyone. We're getting notified of any encampments or any outreach needs in their particular districts. And then we're also working together to figure out the best strategy to help individuals that are dealing with or experiencing homelessness. One of the great things is having the rapid rehousing component to go alongside the outreach, because even if we're not able to get someone that is willing to take shelter at that time, we can still rapid rehouse those individuals and link them to services to get them placed in the housing. So during this time, we offer training for our individuals. We do case conferencing, and we're creating a by name list that we can utilize to make sure all of the partners have the capabilities of providing that rapid rehousing service to those individuals that we encounter. Next slide, please. So in each district, we have the following agencies listed. I will not go over each one. It's a lot of information here, but I'm sure this slide will be provided where you can see each agency that's working with us in each district. The great thing about this is we not only have services that are doing during the regular hours, but we're also working together right now to create an after-hour response for the outreach, for placement for individuals that are experiencing homelessness. So I've been working with the leads of the various agencies to get that response into effect. We know that fire season was upon us, and we were dealing with that. So we were responding to those things as well. So we want to make sure that this is a comprehensive approach towards outreach that not only deals with encampments during regular hours, but after hours needs as well. So right now, this is the approach that we're utilizing. We are using a summary after each event. So in addition to what you guys will see here, there's details provided after each outreach event to summarize the activities that we actually held and the individuals we encountered and the services that we were able to provide. So right now it's going great. We appreciate all the agencies that have come alongside and worked with us in this collaborative approach. I definitely appreciate that, because it's not just one of us, it's all of us working together.
Hey, Marcus.
That's it for me. Yes, ma'am.
I have a question, sir. First of all, good job. You guys have a lot going on. I noticed I don't see CityNet on second district for street outreach and rapid rehousing, and I know they've been collaborating.
Yeah, no, they have. Lindsay can make that adjustment, and we can make sure to add it. But they definitely have been there. Actually,
yeah, we can include them, Marcus. We have the city of San Jacinto is subcontracting, so we just had the agency we awarded, but CityNet is definitely involved with the response out there.
Yeah, and they've been great. We're working with them in each district, so great job with that team, and we appreciate it. We'll get them at it.
Thank you.
Thank you, ma'am.
Can I clarify on this, Marcus? So these agencies that are listed are the funded agencies, is that correct?
Yes, sir, correct. But in addition to the funded agencies, I must be honest, each city has representatives that have come alongside and helped that are receiving funding, like from individual cities. I can tell you Salvation Army helps us in Moreno Valley. We have other agencies that have jumped on board, which is what we're looking to do. We're encouraging that. And we want to be able to help those cities do that work in their individual cities. So we want to provide that sheltering for them, for the individuals that they actually encounter, and make sure we're support for those cities as well.
Great. And yeah, I would just note that in District 4, obviously CVAG and their CV housing program, and I know we work very closely with you on that. So
yes, sir. Absolutely.
Michelle, I see you have your hand raised. Michelle disappeared. Laura.
Hello, I just have a question. When you say street outreach, is it individual outreach to individuals or encampments, or what would be kind of the population? Well, I mean homeless population, but who do you actually do outreach to? That's my
Great question. So we actually do outreach to both. It's not just encampments, it's not just individuals. What we do is we receive an initial request. It'll probably come to myself. I meet with the leads and we get the leads together so that we can have someone from one of the lead agencies, go out and do an assessment of the area. Once that assessment is done, we dispatch accordingly to make sure we're dispatching based upon the need at that time. So we don't want to dispatch 40 people to one individual. It's overwhelming. So we want to make sure we dispatch accordingly.
Thank you, Marcus. And I had another question. Just recently, I was talking to someone that was new to our team, and he had a really good question that I think this is really great for, because as we were talking about seeing more and more homeless individuals out in our communities where we live and so forth, you know, his question was, so all of those people that we see out there, they've been approached and they've been offered services, right? And
Yes, ma'am.
so,
well, not
yes,
all.
yeah, and so I'm assuming that the answer is yes, of course, but I think this really helps to kind of highlight or kind of really confirm and confirm that outreach is happening to those individuals that are living in the street. So I appreciate being able to see this, because the answer would be yes.
Yeah, what we do, if I can speak to that just a second, we actually go out to the areas, and even if we're dispatched for a particular purpose, like when we went to Banning, we went and went through the entire area where we were covering to make sure we had a chance to cover the ground. So what we try to do is we want to offer it to anyone that we encounter. So and the team will tell you, I'm about getting bodies into housing, getting them off the street. So when we go out, that's what we're doing, and that same momentum and drive that I'm speaking to, the team has as well. So all the agencies that are working together, we're all going out there trying to get that energy out there and provide that service to whoever we encounter.
Thank you, Marcus.
Yes, ma'am.
Michelle.
Sorry about that. Greg, you brought up a good point too about whether the cities that are listed on here are funded or not. So the city of Riverside, we also contract with CityNet and also Step Up that are current. So I don't see CityNet under District 1 and 2. Would they be able to be added? And then my second question was, there are times where we get calls from businesses that are being impacted by encampments that aren't located in the city. So would we reach out to you, Marcus, or is there a lead for District 1 and 2 in those areas that we'd reach out to partner with?
Yeah, absolutely. Shoot that email over to me. I've actually already went to Harupa for a furniture store that was experiencing someone that was around the area and they were worried. So shoot them over. We'll get somebody out there same day.
Perfect. Thank you.
Yeah, and just to clarify, this particular list isn't inclusive of all funded street outreach and rapid rehousing projects. This is only for the ESG CV CoC allocation.
Great point, Lindsay. Thank you.
That's helpful. Thank you.
Tanya, I'm going to get to you in just a second. I am assuming we're tracking all of this for good reporting back to the districts.
100%. Yes, sir. We have summaries that we get after each outreach encounter. We have the by name list, so we're making sure we document each activity and the individuals that we serve.
Great. And I know my boss and I know other supervisors are visual. So, you know, again, don't go to a lot of work, but a cool little dashboard would be great on those reports if possible. So, all right, Tanya.
Greg, I promise that you're like reading my mind and it's not me just trying to impress you, but one of the things I was going to share is that our team is working closely with the county's IT team. We actually met with them 2 weeks ago. So they are providing us with training in ArcGIS so that we can mirror, at least for county staff, if you recall, during the launch of the start of the COVID pandemic, the EOC created dashboards demonstrating the impact in each community across different systems. And so we are looking to ArcGIS to create dashboards to reflect the progress of this program. Secondly, I just wanted to share that this has really been a dream. Like those of us that have been part of the continuum of care and doing homelessness for the longest time have often dreamt about a coordinated, response effort. And of course, with coordinated entry and, behavioral health, launching the 24/7 hotline, that really, got us started. And so this is really like the next big step in which we can better support that system so that as requests come in through the community, we can make sure that we have dedicated teams ready to respond. And I think the biggest thing, I know we have a lot of social workers on the line and case managers and street outreach folks, as well as people at all different levels. But the biggest piece here is we recognize the value in having dedicated persons, right, in each community who have built regular rapport with residents in those areas, who can serve as a constant support person when those responses come through. Oftentimes, we're all trying to leverage our teams to respond to, sorry, it's a really fast car, respond to needs across the county, which is great. You still get a person out there, but it truly makes a difference when it's a known case manager, outreach worker, navigator to that person. So thank you guys for, again, continuing to inspire us and giving us these types of ideas. This is very much a pilot, and I can tell you we have, again, emails from the state just really recognizing Riverside County for this work, and to the extent that they have even said they have participated in these meetings, but they have also said, send us copies of your videos because we want to share, we want other communities to do what you're doing. So all around great work, and we thank each of you for it.
Thank you, Tanya. Great points. So, Marcus.
Last thing, Greg, I just wanted to add is in addition to this, we added a navigation call where we're actually helping individuals locate units. So we're augmenting this because the one big thing that we noticed from each district was that there's not enough housing, not enough units. So we have our team with the county working with property managers, working with developers, trying to make sure we get first precedence when those units become available, and we're building those relationships to build up our housing inventory. So in addition to this, we're also working on housing inventory to make sure we can house those individuals. So more to come on that. We have a meeting on the 29th where we're gonna have goals established towards housing leads that we're gonna get each month to house the 420 individuals in.
Fantastic. Tanya, I'm just going to echo your comments. Especially as we've gone almost 2 years now through this strategic planning exercise, we've talked about regional approaches, and we look at both the regional approach of the county as a whole and the county's overall arching goals in addressing this. But I really, really applaud you and the team, Marcus and Lindsay's primarily too, over this district by district outreach. We know that District 4 is very different, say, than District 1. I mean, there's commonalities in homelessness and how we approach it, primarily the commonality of the lack of housing, but there are different ways and different agencies that provide help in each district. So I really applaud this. I know this is a pilot, but you have my full support, and I would assume the board office's support as well in making sure that this becomes a permanent aspect of homelessness services in the county. So any other comments or questions? All right, not seeing any. We will move on to item number 6, standing items. Item number A is the Board of Governance update. we are scheduling a special meeting that's going to be to address the HAP Round 3 funding. Primarily, though, the Board of Governance is still working through the strategic planning. We have been able to work with LaSAR to schedule some kind of workshop meetings, and I know Tanya will probably be releasing some of those dates coming up relatively soon as we finalize those with LaSAR, with our anticipated goal of having the action plan ready to go and out on the street in November. So that's kind of the major updates on that. I don't know if Tammy was still on, if she had anything further to add or not, but.
Nothing further to add. Thank you so much, Greg.
Thanks, Tammy. All right, any questions on that? Sorry.
We're super excited. Go team, go.
Yeah, same. All right, item number B, COVID-19 vaccination coordination effort. Josh.
All right. Hello, everybody. My name is Josh Tomaszewski. I'm with the Riverside County Continuum of Care. Just a bit of background. I know I say this about every meeting, but it's been a while. So we started an effort to try to coordinate vaccination events for COVID-19, specifically targeting individuals experiencing homelessness. So we've been working with various county partners and public health, as well as our homeless service providers within the county to schedule events and really encourage a lot of outreach and identifying individuals experiencing homelessness who are interested in a COVID-19 vaccine who may not otherwise have easy access to that vaccine. So this has been ongoing. We've had several events that we've coordinated. I have 3 right here that are more recent within the past month, just to show how our current trends are going. So we did have 2 events at St. Kateri's Church. That's in Banning. Faith in Action was instrumental in hosting this event, organizing this event. We can't thank Carol Alba enough and the team there. There was an event on August 10th and a follow-up event 3 weeks later on August 31st. That follow-up event was to provide a second vaccine to anybody that received the Pfizer vaccine on the 10th. In total, between the 2 events, there was 139 vaccines administered, which is amazing. You can see the breakdown on each date there. I can recall when this effort first went underway, there was quite a few people being vaccinated, and since then, as more and more individuals are vaccinated, the numbers seem to taper off. But this was just a great to see that people are still interested or have become interested. And again, Faith in Action really provided a lot of that outreach. And so thank you to them, and thank you to any other partners who provided any outreach, bringing individuals to these events. There was an event at Coachella Valley Rescue Mission on the 1st of September, 42 vaccines administered. Thank you, CVRM, Mark McGowan, and the team there. Really appreciate taking the initiative and organizing that event too. We did have an event yesterday at Riverside Access Center. We had one a few months ago as well, and it's just great to have that consistency there. We're still awaiting results since it was yesterday, and I know that the teams, the vaccine teams, leave around 6. So just waiting on my contact with public health to let us know how many vaccines were administered. But I did want to put that on there to show that we are still organizing these events. Please, if you have any interest in hosting any events regarding COVID-19 vaccinations, please let me know. I'm going to put my email in the chat, and I will put my phone number as well. Keep up the good work, everybody, and thank you again.
Thank you, Joshua, very much. Any questions or comments for Joshua? Tanya keeps pointing out how Riverside County leads. I just want to emphasize again that not only the vaccination program, but unlike a lot of other jurisdictions in the country, in California, is the amount of infection of our homeless population has been dramatically low compared to so many other jurisdictions. So that, again, from the leadership of the CoC staff, has just been incredible from day one. So All righty, seeing nothing further. Thanks again, Josh, for the presentation and all the work you're doing on that. Item number C, the CoC HMIS lead agency update. Tanya.
Good morning. Again, Tanya Torno, Deputy Director with Riverside County's Continuum of Care. You've heard me chime in on a few items. I am going to start off with a few CoC updates, and then I'll certainly jump into some that are related to HMIS. First and foremost, I wanted to share that our team is growing in the last year, and really it's been more than a year now. We're looking at quickly approaching 15 to 16 months since the transition from DPSS to our Department of Housing and Workforce Solutions. Our budget has grown from what used to be approximately a $20 million budget to now almost a $60 million budget. And again, a lot of that due to our ESGCV project, which you've heard about. So to that end, we are growing. We have quite a few temporary assignments that are carrying us through for a 6-month period, but we've also added some new permanent positions. And I wanted to share, give you some preliminary news that we are going to be welcoming a new administrative services manager in the next few weeks. And again, we'll invite this person to join us for our Continuum of Care meeting in October to do a formal introduction. But in the meantime, I just cannot, wait to share the news. So we want to introduce Emma Singh, who many of you have worked with and is with County Animal Services, and has experience both with the Department of Public Social Services and the Housing Authority. She very much shares in the passion that each of you have to serve the community. And to our benefit, I know you guys are going to love this, has a strong background in contracts. So we'll be working very closely with our contracts team to really help us, get agreements out in a more streamlined, effective way. In addition, of course, she has a strong programs and dedicated planning experience. So this announcement comes at a very opportune time. I know a lot of you have reached out to me regarding my maternity leave. I am 7 weeks shy of my due date, which is November 8th. And so I'm excited to be able to work with Emma for, approximately 4 weeks is what I have in my timeline to help her get transitioned to the new role. In this capacity, she will be supporting all of our different units with a special emphasis on contracts, HMIS, and planning. And again, we'll make sure that she comes in during our next CoC meeting to do a formal introduction. But at least in the meantime, you, like us, can wait in anticipation for her new start date. Welcome, Emma. Secondly, I just wanted to really take the time to acknowledge cities who have been working with our department, our division, to both implement homeless services and housing. Truly, in the last couple of months, the number of requests that we have received from cities to partner and to serve those that are unsheltered and sheltered in the community has increased. So I've created a list, and I'll just go through these pretty quickly here, but I just wanted to give shout outs to cities of Corona, Norco, Jurupa Valley, Palm Springs, San Jacinto, Riverside, Hemet, Murrieta, Indio, Coachella, Palm Desert, Wildomar, Murrieta, Oasis, Mecca, Moreno Valley, Beaumont, as well as Palm Desert, who again are very much communities that we have had recent conversations with about planning for homeless services, building new affordable housing projects that will serve the population, and are also assisting us with the annual point in time count. With that said, the list is growing, and it's growing because your participation or city participation in these CoC meetings has grown. And by nature, right, as we learn more about what cities are doing to address homelessness, you're sparking ideas and encouraging other communities to dedicate, whether it's their own general fund resources or apply for competitive grants to bring those resources into the community. So I often get asked, what does your city participation look like? And my first resort is always to point out the point in time count, but just had a moment of reflection where I'm like, hey, no, cities are doing a lot more, and we appreciate, working with you to continue taking it to the next level. The last thing I wanted to share was in regards to the HMIS. So our homeless management information system is the database that we use to track all encounters with unsheltered and sheltered residents. So every single program that we fund, every single intervention, whether it's street outreach or rapid rehousing, enters client level data into the system, and we regularly run reports that measure our progress. And I wanted to encourage you guys to check out the CoC staff report that was updated into the Google Drive this morning. Salam Walker, our research specialist, put together a very cool dashboard. Greg Rodriguez has really, again, been encouraging us to do more visualizations that really demonstrate the progress that we're making as a continuum of care as a whole. And so if you take a look at the report, you'll see that during last fiscal year, across all of our different programs, all of your different programs that you administer and enter into HMIS, we've assisted 7,800 individuals. Big deal. And again, we just want to thank you that in the midst of COVID, we did not stop, our efforts did not stop. We continued to provide critical services to that community. That dashboard report will also demonstrate different outcomes across different interventions. And so as we move forward to make, funding recommendations, or look at which activities we want to fund in the near future, the dashboard that's displayed there will definitely be helpful. What we've learned, as an example, is that, things like permanent supportive housing, homelessness prevention work. And while rapid rehousing has definitely taken a dive, where we see 58% of all exits resulting in, consistent stays where people don't return to homelessness, we really are looking to relationships with, our county workforce department to ensure that we can quickly connect people to housing, but also help them find purpose and employment like we do so that they can increase their income and stabilize. So just want to encourage you guys to look at those dashboards. We'll definitely have more conversations about those as we move forward. And then lastly, we did send out an email yesterday. HUD is making updates into, HUD has made some updates and is requiring us to collect additional data in HMIS. And so we've coordinated a special workshop with all of our HMIS administrators and users, which is scheduled for next week on September 29th from 1 to 2 p.m. So we want to encourage you, if you're an HMIS user, please plan on attending that mandatory training session. If you're not a user and you just want to learn more, hey, we thought of you, we welcome you. We want everyone to learn about HMIS because we recognize that as you develop new programs, it's good for you to know more. So that's all I have. Definitely here and welcome any comments or questions that you may have.
Hey, Tanya, I wanted to just mention that, COVID is a good example of when we get support from the state and the feds to relax regulatory requirements, how truly nimble the system of services can be. Because literally in a short amount of time, so many different programs were mobilized. What it felt like overnight, obviously it wasn't that fast, but I mean, much more quickly than the normal process. So I think it's just a good opportunity for us, to continue to try to advocate for relaxed regulations. Doesn't mean we're trying to do a less than good job. It means we're trying to figure out a way to get services and housing and shelter to people faster. So you guys did a great job as usual. I just something for us to keep talking about policy-wise in the continuum.
Agree. Much of that's been around contracting, which Tanya, your team's been amazing. I think that's really been demonstrated through this round of ESG funding, how quickly you got it out. Absolutely amazing. So any questions for Tanya? And welcome, Emma. Animal services loss is definitely CoC's gain. That's for sure. So glad you're on board.
Thank you.
All righty, moving on to item number D, CES lead update. Marcus.
Thank you, Greg. I think I'd second a lot of the comments that were already made about the focus on outreach. We certainly want to support that, and we're trying to do that at all the events that have been mentioned so far. I know events have been talked about in Banning, San Jacinto, the Coachella Valley. We also participated in a large event in the city of Riverside last week. That involved many of your agencies, of course, that are on the line. Housing Authority was there, Animal Services, Operation Safe House, Step Up, CityNet, not wanting to forget anybody, but and then Behavioral Health and Home Connect, those are the ones coming to mind. But it was a big day. We contacted 186 individuals, which is a large outreach event. And 49 accepted some level of service, more than a conversation. 49 were willing to complete a VI SPDAT, accept a ride to go get an ID. 3 people went directly into residential substance use treatment. 1 youth got off the street the same day and into Operation Safe House. So thank you again for Operation Safe House for being there. And my understanding was that his opportunity there is more than just emergency shelter, but that there's a path forward for longer term placement for him. And then a couple individuals with severe medical needs that we were able to get directly into an emergency housing placement. So just a testament to the power of these collaborative outreach events. And thank you to all who started early that day and spent a long day out on the streets. We've included, as usual, our CES update slide that's in the staff report, so I'll let you refer to that if you want details. We've seen a bit of an uptick, thank you, a bit of an uptick in VI SPDATs. I think that's related to the launch of ESG rapid rehousing, as well as street outreach, so that's positive. We are definitely getting referral requests for ESG rapid rehousing. I think we've made 40 referrals thus far. But we definitely need to continue to make more. If you're an agency that has not reached out yet for referrals, please do reach out, and likewise we'll come from the other direction and reach out to you and see if there's anything that we can do to support you in getting that flow started, because we know people certainly need those referrals and want those referrals, and so we want to make sure we're getting that all rolling. On the HMIS side, as it relates to CES, we've made a couple changes, and I say the royal we, those changes, that's all the work of Morel Cabazon. Lots of you are getting to know her. She's our CES coordinator. We've updated so that the consent forms match how it looks in HMIS as well as how the paper form looks. There was a mismatch for a while. And then we're updating our VI SPDAT paper packages, I guess I would say, so that the VI SPDAT and the consents in there are the latest versions and that they match what's in HMIS. But also we've added in the chronic homeless documentation form and a disability documentation form into that packet. Originally, they were separate documents, and so inevitably we would get people sending us VI SPDATs, but without a homeless verification or without a disability verification. So we just want to make that as convenient as possible for individuals to be able to do as much as can be done right there in that visit with their consumer or their client. And then we wanted to make a reminder that specifically on ESG CV rapid rehousing, we do have we're trying to get our by name list cleared, but we also want to be responsive to clients that you have with you that you're working with. So there is a pathway to do reverse referrals. And some agencies have been using that, but others haven't. And so we wanted to make that reminder that if you have clients that are ESG CV rapid rehousing eligible, please indicate that. Let us know, that this is not sort of a generic client that's out there in the world somewhere, but this is already a client that has a connection to your agency and that you would want to serve that person. Morel, I know you're on. Any other updates that you can think of that I'm missing or should share? I'll take that as a no.
I just see Susan has her hand raised, Marcus.
I do see your hand, Susan. If I could come to you in just one second. I remembered one other thing I wanted to share. I know that both Morel on our team, as well as I believe Gordon on the HMIS team, have had conversations with Clarity about what would be the possibility of a true mobile app. So I don't have any promises to make there, but that isn't something that's being explored. The app, or the website, I should say, can be used on a mobile device. I've done it on my cell phone, and it's not bad compared to how some websites are, where it's essentially impossible to use if it's not a dedicated app. But we've heard that feedback from the community, and so we have made that question to Clarity to say, what would it take to have a dedicated app? And so we'll keep you updated if we have further updates on that. Yes, Susan?
Okay, so you were talking about reverse referrals.
Yes.
I have a question on that and how that works with the current CES list. My concern is that an agency could basically do all reverse referrals and basically skip the CES prioritization list.
Yeah, no, that's understandable. We haven't seen that. And part of the reason is that we have essentially, and Tanya or Natalis or anybody on the HHPWS team, feel free to correct me. My understanding is that there's ESG CV rapid rehousing funding allocated essentially to serve roughly 420 households that need rapid rehousing. We don't have 420 households on our rapid rehousing list. And so there's a need to serve additional households over and above what's on the CS list. And that's what allows us to do that without the fear that somebody that's on the list is getting bypassed.
Okay, so my other question that generates one more question is that if we have, and I know you frown on this, but if agencies have people they can identify that end up as a permanent supportive housing level for SPDAT, and we feel that they could potentially be a rapid rehousing contender, let's say, that means we could actually do that now without affecting anybody else on the rapid rehousing list.
Yeah, correct.
Okay.
I like the word contender. I think we need to find a way to write that.
Right, because I don't want to be the person to sit there and say my person who is on permanent supportive housing is eligible for rapid rehousing. I understand that that's an evaluation that the rapid rehousing has to make, because they have to look at, will they be successful in the amount of time that we have to work with them, as opposed to permanent supportive housing. So I understand that, but I appreciate the possibility of doing a referral that way.
Yeah, and just to be transparent, that's already happened. We've had agencies accept households that have what we would call permanent supportive housing score, accept them into a rapid rehousing grant.
Right.
Lots of you know this, but just sort of a reminder, because we always have a mixed crowd on these meetings. The VI SPDAT assessment, our homeless acuity assessment, the great bulk of our unsheltered homeless adults are single adults. But for families, they get additional sort of risk points based on things related to the family. Do the kids do this? Do the kids do that? Do you have ability to, get the kids to school every day? Whatever those different questions are. It can be really, really easy for a family to score up into the permanent supportive housing range, even a family that's quite self-sufficient. Mom or dad work, maybe both work. There's income, but there was a loss of housing, and very quickly they get this score that looks high, but on paper, this family really has a lot of skills to resolve their situation and just needs a short or interim amount of assistance. And so, especially in cases like that, I think it is a best practice to try to make that referral down, so to speak, into a rapid rehousing grant, as opposed to having them wait for a permanent supportive housing grant that, one, is less available, and two, they may not need a lifetime of assistance. I think I saw Karen's hand next.
Thank you. So if I missed this, I apologize. I wanted to just talk about the concept of a hybrid permanent supportive housing project. Our program, it's something we're going to try to experiment with our TVRA funds, where we could match supportive services with the TVRA assistance, which is like rapid rehousing because it's time limited. Obviously, it's almost the same. It's just a different funding source, so that we could get people housed and provide the supportive services rather than saying, you know, they're not a match for rapid rehousing, so we're going to wait for permanent supportive housing. But a hybrid model can get people rapidly rehoused, give them the supportive services, and then, you know, work toward the long-term permanent housing placement. What are your thoughts about that, Marcus? Because it's something we want to try to launch in Corona.
I think on face value, it makes sense. And I think that there's more opportunities to do things like that already with things like the EHV vouchers that are coming down. And I'm hopeful that those opportunities are only going to grow, to have ways to use things like rapid rehousing to get people in quickly, but then to identify longer term sources of subsidy for those households that need it.
Yeah, and I just mean, you know, trying to wrap around the behavioral health services in that rapid rehousing environment, so that it's like PH, you know, permanent supportive housing. It's just, you know, it's temporary housing funding source. So anyways, that's all I wanted to mention.
There was a comment in the chat, Greg, from Jean Astron, saying that she was concerned about a spike in homelessness due to the end of rental forgiveness. Jean, I think that's on everyone's mind. Certainly, I think the rental assistance programs like United Lift, like at the state level, Housing is Key, are resource people should certainly tap into. But I think that that's in all of our collective interest to stay focused on and identifying how do we help prevent homelessness as well as end homelessness for those who are out on the streets.
Yeah, agree.
That's all oh, sorry.
No, go ahead, Marcus.
I was gonna say that's all the updates I have, Mr. Chair, unless there's other questions.
And Josh, I don't know, in the staff report, the lead update, I think in the city by name, some of the rows and columns got a little off, so it doesn't need to be corrected this time, but just to note, because this slide's correct. The one in the report is off. So, all right, thank you, Marcus. Great report. Appreciate that. So,
yep. Thank
all
you.
right. Item number E is housing update, and this kind of goes off of what Marcus was saying. I really, you know, I brought this up at one meeting we'd had recently. But Marcus mentioned the United Lift rental program, and we just really wanted to highlight one is that if you know individuals that still are behind on rent, that they should contact this. The parameters have opened up a lot broader than what they were originally. But I just wanted to give you some high level data because we're hearing across the country about certain states and cities and counties not spending their money. In fact, I think countywide or state or countrywide average, sorry, is about 11%. But I just wanted to give you some high impact numbers about how successful Riverside County has done, especially under the leadership of Lift to Rise and United Way of the Inland Valley. But, you know, we've assisted already 13,000 households. The average distribution is about $9,200, over $80 million dispersed. That is a really important number because if you look at that end number of 95% of all funding has been, of the CARES funding for the rental assistance has been spent by Riverside County. That compares to counties like LA that are around like 60%, San Bernardino around 65%. There's some counties in the state that are as low as 30 or 20%. So just emphasizing again how well we've been able to get this money out the door. And then and this is all located in the Google Drive for you to look at, but just some interesting statistics on the number and demographics of the household. And then really to Gina's point is, looking forward, what do we do for prevention efforts? And again, it's going to get back to the lack of affordable housing in Riverside County, and that's throughout the county. I will give our housing authority credit and Heidi's department as well on the moves that are being made to increase that supply of affordable housing throughout the county. So just wanted to give a little 30,000 foot view of another successful program for the county. Any questions or comments at all? All right, seeing now we'll move on to consent items. Obviously, the CoC staff report that Tanya mentioned, that is in, again, the Google Drive as well. Again, she mentioned it, but I want to say thank you for the dashboard on the HMIS data. It's fantastic. I was glad to see that in the report. So, and then B, the committee reports, of course, were attached. We didn't have any requests for letters of support this time. And then again, the performance report for Jewish Family Services of San Diego, their PSH consolidation in the packet. And then I know I'm moving fast through the slides, Josh, sorry. And then the final thing will be called for agenda items for the next meeting. I'm sure we'll be discussing some of the HAP3 allocations. And if you have any, again, just email the CoC staff. And then on to announcements. Tomorrow we have, pulling my slide up here, sorry. There's a multidisciplinary webinar again. This is a homeless panel discussion. This is going to be a great webinar. It's actually those with lived experiences, and if those of you have read the flyer that went out on it, some pretty moving stories. So I'm looking forward to actually moderating that panel tomorrow. And then August 14th, we'll be addressing the developing of affordable housing. And with that, if there's no further announcements, we will adjourn this meeting. And again, thanks to everyone who participated. We were up to over 90 people again this time, so great turnout. And again, thanks to staff for all your work and to my Vice Chair Karen for the support. So thank you all.
Thank you, everybody. Please make sure you complete that feedback for us. We really want to know how we can make the meetings better for you in the coming year, like Greg said. So feedback, feedback, feedback.
God bless everybody. Have a great rest of the week.
You too. Thank you. That was nice.
Bye, everyone. Thank you, Greg. Thank you, Karen.
Absolutely.
Thank you, Greg. Thank you, Karen. Have a good one, everyone.
Too.
Thank you so much. Very informative. Thank you. God bless. Shalom.
Greg and Karen, it's obvious you guys are leading us in the right direction.
Oh, come on. It's a huge team effort. So pretty exciting.
Hey, Tanya, can I give you a call real quick?
Yeah, you know what? Let me type in my new number in the chat box.
All right.
Because I had to change this. I had to change this to